In Health Watch, new FDA guidelines on the COVID-19 vaccine are causing a fair amount of confusion as the fall season approaches. Joining me now, Victor Jacobo here in studio. First time on before. Great to have you, one of our newest reporters. This is a hot topic, and I know you talked to some health experts trying to clear up some of the confusion. So what are they saying? What should we know as we enter this fall season?
Yeah, Marie, so the Trump administration maintains that anyone who wants to get the vaccine can go out and get it. But the health experts I spoke with say that they're worried that the new guidelines set up by the FDA last week is going to create some hurdles, some obstacles for people who do want to get the COVID-19 shot. The FDA last week authorized updated COVID-19 vaccines for anyone 65 and up, but younger people are only authorized if they have an underlying health condition that puts them at higher risk for severe disease. If you're not in those groups, depending on what state you live in, it means you may need a doctor's prescription or pharmacies may not provide the vaccine.
Chicago and the state of Illinois, COVID activity has been rising, especially in children above the age of 4.
Dr. Katrine Wallace, an epidemiologist at the University of Illinois at Chicago, says COVID infections remain a concern and vaccines are still an important tool. Illinois is among the list of states that do not require a doctor's prescription to get the vaccine at a pharmacy following the new guidelines.
It is very confusing.
Wallace says the new guidelines at the federal level can have a negative impact as health officials battle the issue on the ground.
This wrench being put into the recommendations only causes public confusion and increases vaccine hesitancy.
We are going to try to make things as simple and easy as possible while following all laws and regulations.
Sharon Webble, the chair of Cook County Health Division of Infectious Diseases, tells CBS News Chicago her agency will continue working to make shots available to the public.
By doing that, we're taking away a huge barrier, right? You know, one doesn't have to go to the pharmacy. One doesn't have to go make sure that their insurance is going to pay.
Yeah, so a lot of people typically go to the pharmacy.
Right.
I reached out to CVS. They say that the state laws are what dictates what they can do. Here in Illinois, you don't need a doctor's prescription to go there. You can set up an appointment. I actually went on my phone today to try to set one up. Went through the forms, and it'll ask you, do you have any of these underlying conditions? At the moment, I was like, no, I don't think so. I think I'm okay. Would not let me set up an appointment. I went back, and I'm thinking, well, I haven't been very active, so I'll put physically inactive. Then I was able to move forward with setting up the appointment. So,
interesting. Okay, so it's really going to depend on what you're dealing with.
Absolutely. And, you know, both insurance, folks who are on Medicare, Medicaid, still a lot more questions that have to be answered. The CDC meeting later this month, hopefully that meeting sheds a little more light on what the situation is going to look like going forward.
And a little more clarity. Thank you so much, Victor.
For sure.